Okay, good morning, everyone, and welcome to the final session of the RaCEEs course, session 6. And today we're going to discuss about the introduction. We're also going to talk a bit about the workshop, what to expect at the workshop in September. And then we have a little Q&A session if you have any questions about the work so far and the course in general. As usual, I have to say that the session is recorded and will be made available on the Arc Novus course YouTube channel. If you have any questions about the recordings, do let us know. So, first thing I want to say is if you have any questions about the homework after the last session, so session 5, as you probably remember, there were like 3 questions for each team about the interpretation of the results from your paper. Do you have any questions on that? Okay, so I know some people sent the homework in the last few days. We will try to give you feedback as soon as we can, but if you want to send your homework later on in the next few weeks, that's fine. And again, we will try to send you our feedback as soon as we can. Now, today's session is about introduction workshop and Q&A, and in particular, we'll focus a bit on the introduction section. So far, we covered the method section, as you know, key attributes, economic evaluation, cost data, outcome data, we done all that. Last session, we talked about the results, the analysis and main analysis and the sensitivity analysis. Now we kind of move backwards and we go to the introduction section, which is actually the first section of our commentary paper, of our RaCEEs paper. And in particular, we will focus on why the economic evaluation is important and how we add additional knowledge. So we will try to find some info regarding the rationale of this economic evaluation for each team, and find some info about the context, the particular condition, and the particular economic burden of that condition on the population and the healthcare system and the wider economy. So this is our focus for today, and of course we will talk a bit about the commentary, but that will be the focus for the workshop. So overview for today's session is to identify the type of information required to write up the introduction. We will also outline what to expect at the workshop, and you will have opportunity to ask us questions about any aspects related to the development of the RaCEEs. So in terms of the introduction sections, we will look at these elements: the prevalence, the impact for individuals and caregivers, the economic impact, the justification and the aim of the economic evaluation. Then, of course, we will talk about the workshop a bit more, and then we will have a little Q&A session. Okay, let's make a start. So if you are familiar with the RaCEEs, so rapid conversion of evidence summary, you will know there is a recommended structure for that kind of work, that kind of output. We will follow an identical structure. We will add a few economic information to that. Basically, it will be including 4 elements. The first one is the prevalence. So we will need to describe the prevalence for that particular condition, and it literally means trying to find out some information about the number of people affected by that particular condition. That could be the actual number, the actual count of number, but it could be the percentage of people affected by that condition in a specific country or internationally, and so on. The second element we need to look at is the impact on the individuals and caregivers. So rather than numbers here, we're looking at mainly symptoms, issues that people living with that particular condition are experiencing. Also, how the condition affects the caregiver. So if you're looking at dementia, if you're looking at people with alcohol disorders, how those conditions, how those health situations, let's say, affect the lives of the individuals and the caregivers. Then a third element which we need to look at is the economic impact. Of course, this is an economic paper at the end of the day, so we need to describe the burden, i.e. the costs on the individuals, the healthcare system, and the wider economy. So this could be, out-of-pocket payments that people have to incur. This might not be so usual in the UK, but if we are looking at international studies, which some of us are doing in terms of the paper we are analyzing, there might be some out-of-pocket payments which might be relevant for people living in other countries. Impact on the healthcare system, for example, on the NHS or the wider economy as well. Okay, how that particular condition might affect the wider economy. So all these elements, prevalence, impact of individuals, caregivers, economic impact, will give the reader a sense of the context of the background information which we need to then try to formulate a justification for the economic evaluation. Now, this is what the economic evaluation aims to find out and why, and it's usually information that we can find directly from the paper. So if you had a look at the paper and if you had a look at the introduction section of the paper, usually one of the last paragraphs covers the justification for that particular economic evaluation and what the authors are also aiming to finding out. So this is the structure for our introduction section that we will write up together. In terms of where do we find the info for all these elements? Well, for the prevalence, we can look directly at the introduction section of the paper. We might find something there, but I would recommend that we also look at other sources to try to find the info which come from other sources to support our sentences around the prevalence. The same for the impact on the individuals, impact on the caregivers. Again, we might be able to find something within the introduction section of the paper, but it's also good to find information from other sources. The same for the economic impact. And as I was mentioning before, is that for the justification and the aim of the economic evaluation, we usually find things directly within the introduction section of the paper. Now, when I say we, this work is kind of split into two parts. Today's homework and the homework we will do after today's session is all about extracting info about these elements. And then we, the team lead, will write up all this info for the introduction section. So we will do half of the jobs each, basically. Now, I'm going to cover here how we can go about identifying the info about all these elements in the introduction. But before I do that, do you have any questions on the elements so far? Okay, that's fine. Okay, I'll move on then. Okay, here we go. So how to identify the info? The first thing I want to say is that when we write the introduction section and when we identify the info for each element of the introduction section, is that we need to have one or more references to support each statement we are writing. That's really important. We might have some ideas or opinions about how a specific condition affects the lives of individuals, which is fine. We might want to write that particular opinion down and formulate our views on that particular condition, but we need to find a reference which supports that particular view. Otherwise, it feels very subjective. And when it comes to submit the paper, the reviewers from the journal might pick up on that and might criticize the fact we are lacking references supporting that particular statement. So everything needs to be evidence-based. Everything we write needs to be supported by one or more references, with exception of the aim, of course, because the aim comes directly from the economic evaluation paper. So, we can just reference the paper itself there. We don't have to find any other reference for that. So where do we find the info for the introduction? Well, the first thing I will say is that it's good to find relevant literature around a specific condition. So our paper might be dealing with vaccinations, dementia, genomics, alcohol disorders. There will be other papers which have dealt with that particular problem in the past. And we can find the relevant literature in order to identify info about the prevalence, info about the economic impact, info about the impact on individuals and caregivers. Where do we go and find that reference? Where do we go and find those references? Sorry. PubMed is the place where we can find relevant literature. And you will remember we used PubMed during our first session with Kath. And your homework after the first session was to go and find your own preferred economic evaluation on PubMed. So here we are kind of exploring PubMed in a different way, and I will show you in a minute how to find relevant literature on PubMed. Other sources where we can find info around the prevalence, economic impact for individuals and caregivers are reports, public reports, or grey literature from national and international bodies. I've given you a few examples here, but this is not an exhaustive list, right? So you can find other things. Just you can Google things and you can find reports from other websites, from other places. That's fine. Here you got a link to the WHO, to the Office for National Statistics, to the NICE website. But also a good place to look for information is the website from the charities which are dedicated to specific condition, for example, the Stroke Association, Alzheimer's Society, and so on and so on. So, you got a variety of places where you can find info about all these elements. I'm going to give you an example now on PubMed and how we can find info around the different elements on PubMed. So the first thing you will have to do when you go on PubMed, and you got the link on the previous slide, so you open PubMed and you can type the title of the economic evaluation you're looking at, and then you will find it within the records. So what happens is you can see the search bar here. I copied and pasted basically the title of the economic evaluation for Team 1, search for it, and then I found the paper. I click on the paper, and then this is the screen which I will get with the actual paper, the abstract, and the actual body of the paper. Then what I will need to do is scroll down the screen about halfway, and then PubMed will have a list of similar articles. And this list which will hopefully begin to lead you to the evidence we need. So the paper we were looking at is an economic evaluation of rapid and ultra-rapid genomic testing in critically ill infants and children. And if you look at the list of similar articles, you got papers which are looking very similarly at the same issue, the same condition. For example, the first one is rapid genomic testing for critically ill children, time to become standard of care, and you got other papers there which are really similar, and they all belong to the same disease area, basically. Now, what you can do is just maybe look at the title. If the title suggests that you can find some of the info around preference, economic impact, impact on caregivers and individuals, you can click on the article and you can try to find that info. So that's the thing I would suggest that you do, just to go through the list and try to see if any title might suggest that that particular paper includes relevant info for the elements we need for the introduction. Once you find the info, so once you find a good paper, you found the info that you want, for example, you find a good sentence about the prevalence of the disease, then the next step is to extract, which means copy and paste the relevant info from the paper. And then, very important thing, you will need to make a record of the reference you're using. So, for example, you got a paper here which might be relevant. You find an information which is good for the introduction section, and you copy and paste that information, and then you cite the paper. So you can click on the right-hand side here, the bottom side, and then you will have a pop-up window opening up, and you can very easily copy the whole reference, and then you can paste it on your document, basically. But it's really important, this bit, because sometimes we find the info and then we forget to copy and paste the reference. So it's really important. We do both. We copy and paste the info from the paper, but also we copy and paste the full reference, which we need in our commentary manuscript. Any questions? Okay. I'll move on. Okay, so this is the first bit. So how to find, how to identify and extract the info from the different papers and from the different websites as well. Now, these are just a few examples on how to write up the info on the introduction. We are going to use our usual RaCEE we've been using during the course. And I'm going to show you a few paragraphs. The first few paragraphs here are about the impact on individuals and the prevalence. So you got, I think, a couple of sentences which describe what advanced Parkinson's disease is, how this disease affects people, like they might have difficulty walking and talking, they also have mental and behavioral changes and so on. And then in the second paragraph, you got information about the prevalence. So 145,000 people live with the Parkinson's disease in the UK, or were estimated to be living with Parkinson's disease in the UK in 2018. And of these, approximately 10% will have advanced Parkinson's disease. Importantly, you will see that each sentence, for each sentence, we got a reference, which you can see here within the brackets, or even more than one reference in some cases. And this is really important. The second element, economic impact. For this particular RaCEE, we had a section, a subsection, let's say, all about the economic impact. So we had some information about the cost for the patient, but also we had some information on which costs were more important. For example, costs related to the provision of professional care that were contributing to 35 to 77% of the total cost across the different states. So, we had quite in-depth information about the cost here. And again, we used one reference here to identify the cost information, and this particular paper by Findlay et al. And then for the last element, justification for economic relation and aim, all we did is just paraphrasing what the authors said in their own paper. So the authors justify the rationale for that particular economic evaluation towards the end of their own introduction section, and we paraphrase that bit here. And we also paraphrase the aims of the economic evaluation in the last sentence here. So in a way, these elements, the justification for economic evaluation and the aim, these elements tends to be easier in terms of identification and writing up of the particular information compared with the other elements. All you need is really in the introduction section of the paper. Okay, now I'm gonna give you some information about the homework. So what you will need to do after this session is to find and extract info on each of the introduction element, introduction component, including the reference you've used. So that's really important. And I'm going to ask you to complete this task by the end of August. I know some of you will be on leave now, and we will give you a few more weeks for this homework. If you need maybe a bit of September, that's fine. Don't worry too much about finishing everything by the end of August. And what you will see in your homework document is a table with some information about the introduction item. So you got information about prevalence, impact on individuals, caregivers, and then economic impact and justification and aim of economic evaluation. You got in the second column the definition of that particular element. And also on the third column, you also can see that possible sources where you can find information about a particular element. Again, it's not an exhaustive list, so if you want to find other websites, other places, that's fine. The important thing is that after you extract the particular information you need, The important thing is that you copy and paste the reference here on the last column. So you find something on the prevalence, you copy and paste that information, and you also copy and paste the reference you used. So we keep a track of every little bit of information. Any question on this? I'm gonna ask Luis, are you here?
Yes, I managed to join.
Sorry to put you on the spot, but yeah, I was trying to come up with a list of things, of possible sources for information. But do you have any other suggestions yourself where to look for information? For example, economic impact, or do you think there are other places?
For these items in general?
Yeah, or economic impact, prevalence, yeah.
No, I think Googling really, like, depending on the type of theme, in the type of condition.
Yeah.
I think Googling in general, because you have, I guess, different institutions. Sometimes you have institutions really for that type of thing. For instance, when we did the Parkinson one, I think there were some institutions just about, I'm not sure if it was the Parkinson, but I remember when we did, for instance, some reviews on oh, sorry,
I think it was, yeah, you mean like a specific website dedicated to like the issues we were looking at. You mean that?
No, yeah, for instance, when we did reviews around I forgot the term, intellectual
I think it was learning disabilities.
Learning disabilities,
yes,
exactly.
I remember,
so, for instance, we found websites that were from institutions that were dedicated on all types of learning disabilities and related conditions. So, yeah, sometimes you really need to search directly for the condition, and you will have some institutions that do work with those conditions and have reports on those. And then you will see some statistics that may motivate the problem, give some dimension to it. But yeah, other than that, I think the ones you have are more or less the general ones. So I would recommend to Google and try to find.
Absolutely, yeah. I know it seems like
very broad, very general, but
so, no, but yeah, we tend to use Google a lot. No, thank you, Luis. Kath and Zoe, do you have any other suggestions, or do you want to add anything?
I've personally got nothing. I don't know if Kath wants to add anything.
No, I think you've covered everything. There is just one resource I'll post in the chat. It's called LitSense, and it's a website that's connected to PubMed, but you can type in sentences and it will try and match your sentences to the literature. So that can be another maybe easy way to try and find some papers. So I'll post this into the chat.
Oh, that's really useful. Oh, thank you, Kath. Sorry for put everyone on the spot. It's just I was wondering if you had any suggestions. That's great. Thank you. Okay. So let's have a look at where to access the file. You will know this by now. You now have a folder for session 6 on your team space. You can open the folder and you will see a document with your name, with the table, and then you can start the work on that. Okay. Do you have any questions on the introduction section before I move on to the commentary bit? Okay. So this is a really short introduction about what we will do at the workshop and what you can expect at the workshop. So as you know, at the workshop, we will be the 10th of September in Kent at the Castle Green Hotel. Details about how to register and the logistics of the day will be sent out in the next few weeks, I presume, by the comms teams. But I will forward any details to you as well. I don't know precisely what time we will start with the workshop, but I presume there will be a morning bit and an afternoon bit. And in the morning, and maybe for part of the afternoon, we will work on the critical appraisal. So with the critical appraisal, we will work together. Each team will have a table, and we will work together trying to assess the overall quality of the economic evaluation and trying to identify any possible issues which might impact on the overall findings of the economic evaluation. So this definition looks very formal, but what we will actually do is trying to go through a checklist, a set of questions, which will help us, assess in depth what's going on with economic evaluation and assess whether the authors have done a good job in terms of reporting the methods and the findings within the economic evaluation paper. So for example, I'll just give an example. The first question is there a clear statement of the decision problem? Now, if we're not clear about that specific question, we can have a look at the further explanation here. If we are convinced that the authors did a good job, of course, we're going to answer yes. If we are not so convinced, then we can answer no. But it's important that for each no answer, we motivate that. So we got a column here where we can actually write up some, some justification behind our answer. This is the critical appraisal is something that will take us a lot, usually take a few hours to complete all these. There are some questions which we'll do together. Some questions are reserved, let's say, for the co-lead because they're quite technical. But all in all, you will have an opportunity to really, have an in-depth view on the paper and try to criticize the paper in a constructive way, let's say. No paper is 100% perfect, and it's our role for this part of the day to really understand what might be improved with this paper and also justify why we think things might be needing an improvement. So this will take a few hours, possibly also after launch. We will still work on that. And then the second type of work we will do is all about implications for policy and practice. So that means how the findings of the economic evaluation apply to health and social care practice and what they would mean to you as an health and social care professional or as a service user. So a few examples of questions we might want to address here. Should a specific intervention be implemented as a result of economic evaluation? Do we need to think about adaptation for different subgroups of the population? Will the intervention be accepted by individuals and health and social care professionals? Could the intervention be scaled up effectively? Or what will be the main barriers and facilitators to its delivery? These are, questions that will help us think and discuss about, potential application of the intervention and potential implication for policy and practice. Again, this might take some time because it's going to be a group discussion. We all have different views. We all come from different angles as, service user, health and social care professional. So it's important we all contribute. We all contribute with our input towards this part of the work. We are not expecting to have a fully written paragraph around this, but what we usually do is just having bullet points. So at the end of the day, you will have a bullet point which describe the main implications for policy and practice. And then the the team lead will go and write up those bullet points in a paragraph, basically. The third type of work we will do, if we have the time, is to draw some future research recommendations. So what needs to be done and found out to evolve the knowledge of the problem. Again, this is something we are going to do together. Each team will work and discuss things together. We don't need to write a full paragraph. We can just have full bullet points for this. But one important thing is that we don't read the author's suggestions. Okay, so the authors will have some suggestions about future research, usually in the discussion section of the paper. If you haven't read that, don't read it. We will, discuss this together at the workshop, and we will try to come up with our own. And then, we can see whether our own suggestions match up with the author's suggestions or not. And so this is to complete the commentary section of the paper, basically. Any questions? Okay. Let me see this. Okay. Oh, thank you, Kat, for the link. That's great. Thank you. Okay, I'll move on then. Well, this is our QA session, actually. If you have any questions on the course, on the work so far, please feel free to unmute yourself and ask the questions. Or if you have any questions in the next few weeks, you can always contact us. But yeah, if you do have any questions now, I mean, Luis is here, I'm here, so we're more than happy to answer any questions. Okay, otherwise, I'll just move on. And I promised this was going to... Oh, we got a question. Oh, thank you, Bethany. Okay, that's great, thanks. I promised this was going to be a very short session compared with the others, but I just want to conclude this session by talking or actually showing the work you've been doing so far, to be honest. And, today we talk about the introduction, we did the method, we did the results, and we will do the commentary bit at the workshop. But I think this mega table here is a testament of all the work you've been doing in the course so far. You explored each element, and hopefully, you'll have more clarity around these health economic concepts and techniques. On the last column on the right, you also have an indication of the sentences, the number of sentences we need to write for each element. These are like approximate indication. I know these numbers look very precise, but don't worry too much about the precision of them. But just to give you an indication of how much we need to write up about each of these elements, and the fact that there are some elements for which we need to write a bit more, and other elements for which we don't need to write so much. But this is a kind of something that the team lead will do, and writing up all the sections thanks to the information you have extracted when you did your homework, and then you can review the paper with the team leads after the workshop. Hopefully, if things go well, let's say in a month or maybe 2 months after the workshop, we are ready for submission, and then we will send the paper to the journals for submission. Yeah. Okay, that was my last slide, I think. Yeah, so we completed the course now, and if you have any question about the session, today's session, please let me know. And we are really looking forward to see you at the workshops in September. One thing I want to say before I finish is we are going to open the registrations for the next RaCEEs course soon. It will run from maybe October, November until March 2025. But if you like the course and if you enjoy the course, please spread the word with colleagues, friends, relatives, whoever. And we really want to have another set of engaged participants the next time. Apart from that, I just want to thank you for attending today. Thank you for attending the 6 sessions of the course so far, and as I was saying before, we look forward to seeing you at the workshop in September. Any questions in the meantime, feel free to contact the team lead, and enjoy the summer while it lasts, or if it's going to be some summer. Okay, thank you everyone.